So who's going to be my April? Alright. So, good morning. How are you today?
Good morning. I'm feeling crappy.
Okay, I'm sorry. Alright. So, what seems to be the problem?
What do you want?
Just make it up.
Okay,
I'm coughing. Alright, can you sit up please for me? It'd be a little easier if you're feeling good enough. Just swing your legs over. Okay. So, first thing I'm going to do is check her pupils. I guess we just look that's where they are. Okay, just look straight. Okay, great. All right, we both way out. And then we wrap together. Okay. And then I'm teaching you something you haven't learned yet, but it's okay. So just pick your head up and look at your nose. Open your mouth. Get some tongue out. And then up. Okay, great. So, looking at least 30 degrees head of the bed, right? We can be sitting up for the jugular venous distension, right? Mm-hmm. She doesn't have it. Just check the ears. Just got everything looks normal here. Okay. Any pain anywhere? Nope. Okay, great. Hair is all good. So her, before I do this, her AP to lateral is 1/2. Yes? Mm-hmm. Okay. I'm going to go ahead and listen to her lungs. Could you please take your jacket off?
I still got 6 layers under that.
At least I can get 2 layers under that. I know. All right, so I'm going to go ahead and listen to her lungs. Actually, I'm going to listen to her heart first because I'm right here. I'm going to do her apical pulse first. Could you do that so I can see the clock? There's the curtain. Thank you. And how long do you listen to the apical pulse for? Mm-hmm. Okay, so that's what I was doing. Now I'm going to listen to the aortic, pulmonic, tricuspid, and mitral. So, clavicle, first rib space, second rib space. Aortic is there, right across the sternum, be the same. Pulmonic. Okay, first point, tricuspid, mitral. Now listen to the lungs, take a deep breath. Just take a breath through your mouth. And then I'm going to pull this up in the back. Excuse me. You're not too exposed there on the video, are you? Okay. All right. So I'm going all the way up here in the back. Take a deep breath. And again. Now let's see. I couldn't see. Let's see on the video. Okay. Assist your back real quick.
Yeah.
Okay. So up here, right? What kind of sounds do you hear up here?
Up here.
No, not in the back. That's right. Deep breath. Now I'm here in the middle. What do you hear here?
Bronchiovesicular.
Bronchiovesicular. Yeah. The only place you hear bronchial is over the trachea. Again. Again. Okay. Now here. Again. Good. Now I'm doing these middle lobes. Deep breath. Okay. Breath. Thank you. You can get back in here. See here. So while I'm here, just checking her muscles seem pretty even. And I'm going to do her cap refill on her fingertips because she's got nail polish. Okay? And I don't see any clubbing. Let me put your no nail clubbing. Okay? Alright. You check her pulse as well here. Equal bilaterally, amplitude +2. Got to tell you up here, the heart rate was regular. The rate was 72, regular rhythm. Her lungs were clear in all fields bilaterally. If you want to name them, that's fine, but name them correctly, okay? So no murmurs heard. Listen to all the different locations. So go ahead and lay back and check your belly. Are you okay to have your belly exposed?
Let's see if we can get to it back to
That's good. Oops. All right. So I'm going to first listen for the breeze, and then I'm going to do the rest of it. That's what the abdominal exam, right? You listen first, right? Yeah? Yes. I can feel a faint heartbeat, which is normal. Nothing. As far as vascular sounds. And then I'm not feeling because she's exposed, but femoral right here. Okay. All right, so those were all. Didn't hear any bruise, which are what? Swishing in the like a kink in the hose sound, okay, which is abnormal vascular sound. Okay, now I'm going to listen for her bowels. So here's the belly button, you divide it, the quadrants right here, right? Here. Okay, I would say that she's got some hyperactive bowel sound. She probably had coffee. Things are going wrong, okay? So I'm having gurgling pretty consistently the whole 15 seconds. I didn't listen to 15 seconds in each quadrant, which we're supposed to. But I did in this one quadrant, and I was hearing it just consistent. Okay. So advanced practice exam, I always check the liver size. hollow, spleen hollow. Liver can extend down 2 centimeters below the rib cage and be normal. Spleen is never below the rib cage. So if it's not hollow here, it's dull, spleen is enlarged. Liver can come down, like I said, 2 centimeters. I had a 28-year-old, 27-year-old male, heavy drinker, enlarged liver already. So, try to teach people without damaging themselves. Your skin is warm and dry. I don't see any pulsations, any striae, anything flat, right? It's normal. Okay. Can you squeeze my hand? So these are your grips. Her strength is equal bilaterally. Strong. I'm not going to say it's 5, 4, 3, 2, 1. She can squeeze strong. And some people, like guys, don't do much. Or just tell them, don't break my hands, okay? But squeeze as hard as you can. If it's too hard, it's hard enough. All right. And then the next thing I'm going to do is these pushes. So go ahead and push down. Okay, good. And then pull up. Okay, great. I'm going to take your socks and shoes off to check your pulses on your feet. All right. You know what I'm saying without saying it, huh? All right. She's got good bilateral pedal pulses. Her feet are a little cold, but it's cold outside. Check tap refill. About 3 seconds again, his feet are cold. Okay, this is coming back. No nail clubbing. Okay. So that's grips, that's pushes, and then pupillary response we already checked. So that's pretty much the neuro thing, other than the arousal, which I already told you. And can you please tell me your name? And where are you?
I'm in the hospital.
Okay. And do you know what month it is?
Yes.
What month is it?
Is it February?
Okay. Are we about, do you know what's coming up tomorrow? Tuesday, November 6th.
Election. Oh, I early voted.
Oh, okay. All right, date then.
Today, today is November 5th, 4th, 5.
What year?
1912 or 2012.
Did you really check the people? We have a really good patient.
She fell apart.
2012.
2012.
Okay, well she's alert and oriented. Okay, so
You had decaf this morning, huh?
All right. And so is it just some strength exercise? Just put your arms up in the air. Okay. So resist, let me pull them down. Okay, great. All right. So go ahead and relax them down. This is a bedridden patient, so go ahead and let me raise your leg. Okay, and don't let me push it down. Okay, great. The same there, so. Okay. All right, down. So there's a whole lot of range of motion exercises that you've already learned. This is just sort of basic strength, bedridden. Patient who can get up and walk, okay, their musculoskeletal system is intact, unless they've had an obvious stroke or something like that, they can move. You can watch their gait. Are they limping? Are they walking in a normal pattern? Did I miss anything? You watched me do the neck when I went down like this. I'm always checking the thyroid gland. Oh yeah, there you go.
So you checked the femoral.
Carotid pulse, thank you. Huh?
You checked the femoral and you checked
Pedal.
pedal. You don't check the popliteal.
Well, I wanted you to learn how to do it, to practice it. But the reality is, if you feel pedal pulses, then everything in between you've got.
Okay.
If you feel good bilateral radial pulses, then that means your brachial is good, and up here your axillary is good.
On our head to toe exam, do you want us to locate all of them? Or
Yes, you'll locate them. And I forgot to do her carotid, which is what? Am I doing it right?
No.
It's just 2 at a time. I mean, you can't
It's
do
2
both
fingers
at a
at
time.
one side.
Only one side at a time. It doesn't matter if you use 2 fingers. You might need 2 fingers to feel it. All right, and I didn't do the temporal. You're correct. Anything else? I think I got it.
This calls for the mental health status.
Yeah, I didn't go that far.
We don't want to go there with me.
All right.
It's 1912.
1912, 2012.
All right. So mini mental exam. So we know she's alert and oriented. Eventually, she became oriented, right? Okay. All right. So can you? I'm going to give you the name. I'm going to give you 3 words, and I want you to remember them. Cat, apple, sun. Okay. Now I want you to subtract 7 from 100. Okay. 93. And 7 from 93. 96. Okay. I don't know. I have to get my calculator.
Roger's moving her toes.
Yeah, I'm not like, because I'm on video. Okay. All right. 8, and then 10 from 86.
85, 80, 82, 81, 80, 89.
Okay. All right. So her and those 3 words.
There's cat and cat and
Apple sun.
Cat Appleton.
Okay. So her short-term memory is in question. Her cognitive ability to do math is okay. So she has to count her fingers. All right. So if a speeding car was coming toward you and you were standing in the street, what would you do?
I want to do one of those John Clausen jumps and both them.
All right. So
Move out of the way.
She's a ninja nurse.
Jump over it, yeah.
A rolling stone gathers no moss. What's that mean?
You're not staying in one place long enough to put down roots.
Okay. So her abstract thinking is intact. All right. Great. All right. Anything else I need to do or show you? Okay, perfect. Thank you.
I was afraid I might not get released from the hospital today.
I'm going to go ahead and admit